Hello, my name is Dr. Valerie Wood, and on behalf of Barb Joyle and Jim Hallway, I am happy to provide this overview of the Kinship Navigator Collaborative Program model. With this model, 4 states have come together to test a new model of supporting kinship families, and we are so glad that you're going to be a part of this exciting project with us. So, who is a part of this effort? As I mentioned, 4 states are working collaboratively to test a new model of delivering support to kinship families. These states are Vermont, Maine, Wyoming, and Montana. And within our small state of Vermont, 3 organizations are represented. Vermont Kin as Parents as our kinship support organization, DCF Family Services Division, our child welfare agency, and the University of Vermont, specifically the Center on Disability and Community Inclusion. Before I get into the nuts and bolts of the new program model, or how we'll do this work, I want to start with emphasizing why this work matters. This work matters because there's a growing recognition within Vermont and also nationally of the benefits of adopting a kin-first culture within child welfare. There is also a growing recognition that the needs of kinship caregivers differ from traditional foster parents. And we also heard these two needs echoed from kinship families themselves in a recent survey that Barb Joyle and I partnered on. However, there is currently no model of kinship family support that is eligible for federal funding due to a lack of scientific evidence. Therefore, we are embarking on this project to look at a new enhanced model of kinship support. The hypothesis that is guiding our work is that families who are supported by the proposed enhanced model of kinship support will have significantly better short and long-term outcomes compared to families who are receiving services as usual. I want to emphasize here that this is a strength-based program. All 4 states that are working together already have some form of kinship support within their states. And all of those states recognize that that work has been important in creating a sense of community for kinship families. However, there's a recognition there might be a better way to support kinship families. So this isn't about any one state or system doing something wrong. It's more about, is there a better way? And if there is, can we document evidence of that better way? So all 4 participating states will submit their evidence, i.e. data, in the hopes that the hypothesis is supported. If we do find that the proposed enhanced model of kinship support results in significantly better short and long-term outcomes compared to families who are receiving services as usual, then that evidence would be used to qualify this new model for federal funding and support in all 50 states. So we are a test case for a model that may eventually be rolled out nationwide. We do want to anchor this presentation in what we already know about kinship families in Vermont. And so I'm so thankful to Jim and John at VCAP who were able to provide me with some data from your data system. And so looking historically, from 2015 to 2020, the reach of VCAP grew from 40 caregivers to 248 caregivers. VCAP also fields calls from professionals, and those grew from 7 to 49 within the same time period. And I think those numbers reflect 2 things. Number one, there's a growing awareness that VCAP exists among kinship families and the professionals that support kinship families in Vermont. And so as more Vermonters are becoming aware of VCAP, they are knocking on your door and using you as a resource. I think it also represents a growing need, that there are more children that are being raised in kinship caregiving arrangements, and that these families are looking for services and support. Jim and John were also able to provide me with data on the primary referral sources to VCAP. So, how are people discovering your organization? The number one way, which I was really pleased to see, was self referrals. So, whether they're hearing about VCAP from a neighbor or someone in their community, or whether they're going to your website, uh, people are discovering VCAP and they are calling you themselves to say, I'm a kinship caregiver and I really need support with X, Y, and Z. The second most frequent referral source was social services, and then the third most frequent was the catch all category of other. Additionally, I wanted to take a look at why people are calling VCAP. So within your data system, you're able to capture what kind of information requests are coming through the phone calls you receive. And that data revealed that information requests cluster around the following topics: caregiver support, support groups, childcare, parenting skills, and respite services. So these are the most frequently requested pieces of information and or needs represented by the calls you're fielding. And one of the nice ways that this ties into the new model that we'll be testing here in Vermont is that one of the components is offering caregiver education. So if you have a grandma or grandpa or aunt or uncle that's calling in and saying, parenting my grandchild or parenting my niece and nephew, this feels really different than when I was parenting my own children. I could really use some help in understanding new ways of parenting. There's going to be different webinars and different pieces of information that you'll be able to point parents to. We also have data from the Vermont Kin Caregiver Survey. So this was a joint undertaking of DCF Family Services Division and UVM CDCI. So it's one of the previous ways that Barb Joyle and I partnered in this kind of work previously, in an effort to better understand the needs of kinship families, especially informal families. So those are families that do not have official Family Services Division involvement. Family Services Division and UVM CDCI partnered on the creation of a kinship caregiver survey in 2019 to 2020, so right before the pandemic. Kinship caregivers were recruited to participate via social media advertising, so we call that a convenience sample. We put it out there that there was an electronic survey that folks could complete, and we were looking for their feedback. We were really happy to see a total of 185 caregivers completed the survey, and those caregivers were caring for 295 children here in Vermont. So some families, as we know, are caring for 1, 2, 3, or even 4 plus kinship children in their household. Most caregivers identified as grandparents, that was 61%, followed by an aunt and uncle, which is 21%. And the bar chart is put there just as a visual indicator, really, that a variety of custody arrangements were represented in the sample. So again, we have some data about families that have formal DCF Family Services Division involvement, but we know less about informal families, so we really wanted to see to what extent those informal arrangements were represented within our sample. And so that's just a visual of how that was represented within the 185 caregivers that completed the survey. What about the reasons the child is in kinship care? Because we know that the reasons the child is being cared for by a grandmother, grandfather, aunt, uncle, or other type of relative, including fictive kin, really can provide some clues to what kind of supports or services the kin caregiver themselves might need. So, the number one cited reason that the child is in kinship care is the parent's substance use issues. And the second most common is parents' mental health issues. And we know from research literature that these two things tend to be co occurring, that where there is mental health issues, there tend to be substance use issues as well, and vice versa. And so you can think about when you're fielding calls and a caregiver is expressing, what their needs are and telling you pieces of their story. If they indicate that perhaps their child, their grandchild, their niece, nephew that they're now caring for as a child witnessed something related to their parents' substance use, perhaps witnessed something related to a parent's untreated mental health issue. And so, if the child experienced a traumatic event such as that, what kind of supports are available to connect them to that are trauma informed? The third most frequently cited reason that a child is in kinship care, which continues to be an issue here in Vermont, we know, is a parent could not get safe, suitable housing. So taking all that data, it paints a landscape of what is the situation regarding kinship caregiving here in Vermont at this time. And in particular, our team, again, VCAP, DCF Family Services Division, and UVM, we are excited about the fact that this project aligns with feedback we received from kinship families in our survey. So when given the opportunity to share how we could improve the system of supports and services, in their own words, kinship caregivers said things like, "I was unaware of some services offered in this survey. Never heard of them, nor have I been offered some." And a lot of us know that help is available, but not how to get it. Or have better advocates for families like ours. Also, assign case manager to follow and support family. And lastly, as an example, my thoughts on what might be helpful to families would be having a caseworker coordinator type person to help navigate the process, as each kinship family may have different or specific needs. I found it overwhelming, time-consuming, and frustrating at times trying to search online for something to help with my needs. So again, I'm so glad that VCAP is at the table for this particular project. Obviously, we couldn't do this work without you to figure out how to better support kinship families in our state, and the components that are represented in this new model that we'll be testing out align directly with this kind of feedback that are coming from Vermont kinship families. So it feels really responsive to their needs and putting families and their children at the center of this effort. So what is the Kinship Navigator Collaborative Program model, which going forward I will refer to as the Kinship Navigator model. This is a visual that was developed by the lead PI on this project, Dr. Angelique Day, who's at the University of Washington, and is really guiding all 4 states in their efforts to implement this model. A little bit of background, this model was created when a number of states, not just the 4 that are currently represented in the initiative, were asked to complete a survey saying, based on your area of expertise and what you know about supporting kinship families, what components are the most important to ensuring that they have positive outcomes for themselves and the children they're caring for. And so this is called a Delphi process, where basically this data was collected via a survey, and then each particular item was ranked. And that was done back in January of 2021, so the beginning of this year. And I couldn't name off for you all of the components, but I know there were some that are not represented in this model. So this represents what are considered the core minimum features of a strong program of kinship navigator support. So you see that there are 6 components to the pie, and again, centered around supporting caregivers and their children. So we have outreach, information, and referral. What that looks like is having a website, um, getting permission to contact the TANF and child welfare offices, um, that the TANF and child welfare offices, as they become aware of kinship families, that they're connecting to VCAP to say, you know, this family just knocked on our door. They look like they could benefit from the services of VCAP. So making sure that families are giving permission for that kind of connection, so more families can be directed to your services, coordinating with 211, sharing information, helping enroll families in public benefits, and social media outreach or advertising. Um, and as I go through each of these pieces of the pie, what I think you'll find is that VCAP is already doing many of those things. It may be worded slightly differently here on the slide compared to the way you talk about them in the office or the way you think about them in your own mind. But each state was interviewed by the lead PI, and we were allowed to comment on which of these components we already have in place, which we have in place but aren't necessarily very strong, and then which we do not have. And really, VCAP had almost all of these components in place already. What about needs assessment and case management? So this one, in a couple slides in, I'm going to talk about how this model will be implemented, and the needs assessment and case management is one of those pieces that is being added. So there are some tools that we'll be sharing with you all to help you walk clients through a needs assessment and determine if they need case management. But high level overview here, there's a pre-screening assessment tool that will be used to determine who gets services as usual and who gets case management. And each state is able to tailor that insurance to their own needs. The collaborative is also going to be able to tap into some caregiver education, which I alluded to earlier. So when those caregivers are calling in and you hear there might be a need to help caregivers and the children understand grief and loss, trauma, self-care, substance abuse, maybe parenting skills, we'll have a list of resources that you're able to point them to and say, you know, we think this 15-minute video might really provide you with some valuable information. So that'll be forthcoming. Peer-to-peer support, that's already your model, right? You all have lived experience. So you understand the unique joys and challenges of raising a kinship child. So that's a fabulous strength of the Vermont team and the work you already do. And you already create support groups, currently I believe online, and previously in person. So that work will just continue. Urgent needs and concrete goods. So there's a ask from the team to say, when you have those families that are calling in and say, you know, I can't pay my heating bill, or I don't have winter coats for my grandkids that just moved in with me. What can each state commit to offering in terms of concrete goods and supports to families? And Jim has shared some details of that with us. And so we feel good that there's already a process in place for that as well. And then partnerships with kinship families and organizations. So we know that it's not just VCAP alone that's doing this work. You already have pre-existing connections to other groups here in Vermont, including COVE, including DCF Family Services, and other organizations. And so here the ask really is to develop an oversight committee that is representative of your caregivers, youth, coalition leaders, and local kin organizations to provide ongoing feedback. And so that is a piece that Barb, Jim, and I are still talking about what that could look like with VCAP. And then training navigator staff and partners in 6 areas: placement options, so really looking at legal relationships and the foster care system, public benefits, trauma, grief, and loss, case management, and cultural competence. And again, for many of those, we'll be able to tap into some amazing resources that are being provided by the lead agencies through the collaborative. So that is the Kinship Navigator model, gives you an idea of the different components. So let's talk about where. This is the new model. So where are we going to be implementing it? So another piece of research jargon here, we're implementing a quasi-experimental design. So we're not doing random assignment groups. We could have, every other caller, the first call of the day is in the enhanced services, and the second caller is in the control group, and keep going throughout the day. That gets a little bit complicated in terms of tracking. What we thought would be easiest, and what other states are doing, is they're doing a county-based implementation. So as the evaluator, when I talked to Jim and Barb about this, about what made the most sense in terms of picking those that would be the pilot sites, we thought Franklin, Grand Isle, Chittenden, and Addison. So that northwest corner of the state, which is historically where VCAP has had more of a reach and more influence. So that felt good. We may make some minor tweaks to that before it's finalized, but Vermont is a small state, so we don't have a whole lot of wiggle room there. So that is our plan for now, and certainly if that changes based on a second look at the data, I would circle back to Jim and Barb, and we would let you all know. So what about how will we do this work? So this is a flow chart of what this looks like. So the blue box at the top is the first caregiver contact. And then we're going to follow the arrows based on each decision point. So each box represents a decision point. And the things that are in blue, light blue text, like the pre-screen tool, those are all instruments that will be provided to you, in which your fabulous IT support person, John, is building into your data system. So you have a place to capture this data, because again, this is meant to be the implementation of a pilot program. So it's a pilot test, and we'll need to collect data from those that receive the enhanced services model and those that receive services as usual, and compare their outcomes at the end to see if those that received enhanced services had those significantly better outcomes, which is our hypothesis. All right, so again, starting up at the top, how will we do this work? So first caregiver contact at VCAP, that's a kinship caregiver calling in. Now what if it's a provider, right? Because you do field those calls from providers. If it's a provider, they're not part of this implementation project. If it's a provider, you can just proceed as usual. We're not really looking at providers within this model. We're only looking at kinship caregivers. So kinship caregiver calls you. You all have been doing this work, so you have protocols for how you start to build rapport and get to know the person. But we're going to ask that pretty early on you identify the county of the caller. And so depending on the county of the caller, that's going to determine whether we're going to go over to the left for enhanced services or to the right for services as usual. So let's assume I live in Chittenden County. So let's assume, it's a kinship caregiver in Chittenden County calling in. So then you're going to proceed with the enhanced services model according to our flow chart. All right, so then that brings you to step one, which is using the pre-screening tool. So I mentioned that there are going to be some new tools and instruments that are provided to you. The pre-screening tool is going to be approximately a 12-item checklist. It's meant to be really fast, really easy for you to walk through the kinship caregiver with. So it's going to ask questions like, do you need assistance with housing? Do you need assistance with childcare? Do you need assistance with exploring legal options? Things like that. And so you're simply going to check yes or no in terms of what this particular caregiver needs. And then we're going to have a cutoff point or a cutoff score. And so let's say that based on the 12 items, a caregiver scores a 2. So if they score a 2 or more, and again, this is hypothetical, we're still working out the details of what that score will be exactly, then we're going to say that pre-screening tool indicates that they have some complex needs. They have more than one need, they have 2 or more, so they're going to get case management. And then we follow the case management flow chart. Before we follow that arrow, let's go to what if they score a 0 or 1? They score less than a 2. If they score less than a 2 in this hypothetical example, then we're going to say this family has some needs, but they're not complex needs. We think we can meet their needs with information and referral only. So then we follow that longer arrow over to the pre-screen tool, indicates need for information and referral only, or if the client declines case management. Someone may score a 2, a 3, a 4, but they may really feel like they just want the information and referral today. Thank you very much. And so that's okay. If they decline your offer for case management, we're just going to put them into the services as usual group. So we have a couple different ways people can wind up getting services as usual. If they live in any other county than our pilot counties, or they score low on the pre-screen tool, or they decline case management. For now, I'm going to go over to the folks that they scored a 2 or more on the pre-screen tool, and they accept the offer for case management. So now they're going to be in our enhanced services group, which is receiving case management. So we have a new intake form that you're going to use with all the groups, and it's really not much different than your current intake form. It just has an expanded demographics area where we're going to capture more information on the caregivers that are calling in, as well as the children in their care. And that's going to be really important at the end of this project in order to understand who was in our sample and make sure they're comparable in terms of racial and ethnic diversity, make sure they're comparable in terms of age, make sure they're comparable in terms of the number of kids that they were caring for. They don't have to be exact, but we do want them to be approximately equivalent in some of these demographic areas. So we have a new intake form that you're going to use with all clients. And then if you're getting the enhanced services with case management, there's a more in-depth needs assessment that just helps you unpack some more specifics around their needs. They get a caregiver stress scale so we can understand the extent to which they're feeling stressed or overwhelmed. And there's a goal setting form. And then what is case management in this model? Well, case management is really letting the client know, hey, we understand that you have these needs, which we've now, walked through and we've captured on the needs assessment. We've captured through the goal setting form. And here's some information, and I'm going to refer you to these services based on your needs. And someone's going to check in with you in 3 weeks, at 3 months, and if needed, at 6 months. That we're going to follow up with you to understand how the situation is unfolding and see if you're able to connect to the services that you need. Because what the research literature suggests and what we're trying to demonstrate here is that for families with complex needs that are feeling overwhelmed, if someone is able to take the burden off of them of remembering to call VCAP, of remembering to follow up and say, yes, I was referred to this service, but now I have another need, I have a new need, or I was waitlisted and I don't know how to proceed. If we can take some of that emotional burden off of the caregiver and instead shift it to say, that's really something that the kin navigator is going to hold as part of their care and support to the kinship caregiving community, that we do see better outcomes for families when that is offered. Again, for those with complex needs. So at 3 weeks, you'll follow up to see if the caregiver was able to contact someone at the different agencies that they were referred to, and there'll be a fidelity tracking tool that you'll be asked to complete as part of that. And then a check-in again at 3 months, where you'll go back to the goal setting form and see if the goals were met. If all the goals are met, you can close the case. And we'll talk about what that means in a minute. If the goals were not met, you can continue to support that case for another 3 months. And then at the 6 months mark, we're going to close all the case management cases. So you'll still use the goal setting form to check in and see, how many of the caregivers' goals were met. But at that time, we'll need to close out the cases in order to have enough time to collect the post data. One thing to note is at 3 weeks, 3 months, and 6 months, when you have your check-in points, if at any point the family feels ready to close the case with VCAP, obviously we're going to follow the direction of the clients and respect their wishes if they wish to have the case closed. But information and referral can continue. So if someone calls in from Chittenden County who you had been supporting and you've already closed their case, but they're just calling in to get information and referral, that's fine. That can continue. If they want to continue to access support groups, that also can continue. So there are ways in which they can continue to be supported that don't impact this particular initiative. All right, so 3 weeks, 3 months, 6 months, all that time passes, and then we get to the last green oval that says client survey. So this is the point of case closure, right? So right now we've been following the enhanced services model. So the case management closes possibly at 3 months, possibly at 6 months. There's a client survey that you'll walk through with them. It has some questions related to their satisfaction with being connected to supports and services. It also has questions about, again, their caregiver stress, that caregiver stress scale, to see if their stress has been reduced. It has questions about, is their kinship child still in their home, to understand placement stability. And then 6 months after case closure, we'll follow up with them again and say, all right, it's been 6 months since you received support from VCAP. How are things now? And the supports and services we were able to connect you to, have they helped to stabilize your family situation? Do you feel like you've gotten the support you need? So the client survey is administered twice, once at case closure and then again at 6 months post closure. So that's for the enhanced services case management group. What about services as usual? So if we go up to the gray box, if a caller lives in any other county of Vermont, proceed with services as usual. So the exception is there is the new intake form, which has those new demographics, and we'll need that information to be able to compare the two groups. And then there's the new case closure form and the new 6-month follow-up form. And those are measuring our short-term outcomes and our long-term outcomes. So we'll need that data to compare the outcomes across the two groups. So if a caller lives in any other county of Vermont, they're going to get service as usual. But also, folks that live in Chittenden, Addison, Franklin, or Grand Isle who did not have complex needs, they scored low on the pre-screen tool, they're also going to get information and referral only, so services as usual. Or folks that live in Chittenden, Addison, Franklin, or Grand Isle, and they decline case management. So you have 3 different pathways by which someone can wind up getting services as usual. But again, as long as you're capturing county of the caller at the beginning, then using that pre-screening tool in the pilot counties, it should be a pretty seamless process for figuring out whether or not you're going to use the enhanced services pieces or services as usual. So for folks that are services as usual, they're going to get the new intake form. You're going to build rapport, understand their needs, and then you're going to do your information and referral as you normally would. And once that's done, then we're going to administer the caregiver stress scale. and we're going to then talk about case closure. So in this case, this is someone who's called in, they really don't want information referral. You provide the information and referral, and then there's no other follow-up time points with those families, with those caregivers. So this is going to feel a little bit more like a satisfaction survey, but you're going to go through that same closure survey that we use with enhanced services, just to understand, the short-term outcomes for that caregiver after they've received the information and referral. And then we're going to follow up with those callers at 6 months post their phone call to see what their long-term outcomes look like. So hopefully that gives you a good sense of these different touch points that we have represented in the model. When will we start to test this new model? So Barb, Jim, and I are still ironing out a few of the final details, but we're very close to understanding what this will look like in Vermont, and especially for VCAP. Jim is thinking about pilot testing the pre-screening form in November to provide some feedback data to our team to understand what the bar should be for that pre-screening tool. Should it be 1 item? Should it be 2 items? Should it be 3 items? So we'd really like to test that out with some callers over a couple weeks to get a sense of how their needs are distributed on the pre-screening form. And then once we have that information, we can make a pretty informed decision about what the pre-screening form threshold would be and begin implementation between December 1st and January 1st. Things we're working on right now are reviewing and finalizing the new forms, building the new forms into the IT system. Again, huge shout out to John for the heavy lift on that. Finalizing what counties will be considered the pilot counties, getting IRB approval, working on data sharing agreements, and of course, fielding your questions. And so that concludes this presentation. When I presented this to VCAP on October 19th, there were a couple folks that were able to pose their questions or comments live, but Jim had made Barb and I aware that a number of people were unexpectedly unable to attend. So we did create this video recording as a way for him to share this information out with all of you so you could watch it in your own time. And so I am available via email, or if you have questions that you want to send to Jim that he can forward on to me. I'll speak for Barb Joyle here as well. We are more than happy to field any questions or comments you have. And this picture here, I want to be honest, I took it off the internet. It was, a public goods picture, but I just wanted to end with a picture of a family to emphasize that we really are centering the needs of our kinship families in this work. And we do think that this model will result in some really significant, better outcomes for our families. So we're excited to be doing this work in partnership. Again, my name is Dr. Valerie Wood. I'm at the University of Vermont Center on Disability and Community Inclusion. And if you want to email me directly, my email is Valerie, VALERIE, Wood, WOOD, @uvm.edu. And we welcome your feedback. All right. Thank you so much and have a great day.